My name is Miles Laptop from Complete Balance Health Center, and today is our educational video for post-concussion syndrome. We're going to talk about what is it, how it's caused, recovery time, and then also the transition from initial injury to persistent symptoms, and then, of course, the treatment domains. So what is it? A concussion, also referred to as traumatic brain injury, is a functional injury, not a structural one. Now, the common myth that bruising and swelling occurs is not true. With a concussion or MTBI, those are synonyms, they mean the same thing. There is no functional damage. So we're looking at these images here. These are CT scans. The top ones are color mapped, so they look cool. A and D are the same. C and F are the same. A and D are healthy brains. There is no structural damage to them. No bruising, no swelling, no fractures. This imaging is unremarkable. Now, this doesn't mean that there is an absence of a concussion. That could still be present. You could still have functional issues or impairments. You could have symptoms, but there is no structural damage. If you have a moderate or severe TBI, so you see here, this swelling outside of the brain. There's also what looks like a fracture here. This is a severe TBI. So MTBI and concussion mean the same thing. Also, imaging is unremarkable, so you may hear this term from your doctor or from practitioners that the scans were clean, but you could still have a concussion. So how's it caused? Well, our MTBI or concussion can be direct impact. It could be acceleration, deceleration, or blast injury, but this one may not be relevant for us. The direct impact could be with your steering wheel, with the airbag, with the side of the window, with the side of the car frame, or it could be with your head on the ground if you're a pedestrian. The indirect is any whiplash motion. So this is where your head accelerates one or decelerates. Still, both things can cause a concussion, whether it's direct or indirect. Both can cause a concussion. So just because you didn't hit your head doesn't mean that the symptoms aren't there or there is a concussion present. So what we're looking at is brain energy levels. There's a lot going on in this graph, and I'm going to simplify it as much as possible. These are healthy controls. We're considering this our energy level in our brain. As we move from left to right here, we're going time post-injury. So we have 3 days here, and we're looking at energy is a bit lower. 15 days, energy is lower. 22 days, energy is still lower. 30 days, we start to get closer to it. We see these are all lower than the control, but we start getting closer at the 30-day mark. So concussion generally is considered that after a month, the brain energy levels are back to normal. Now, if you still have symptoms after a month, then we refer to this as PCS, prolonged concussion symptoms, persistent concussion symptoms, post-concussion syndrome. All those mean the same thing, that the initial acute, that short-term concussion is past, and now there's persistent symptoms. These usually fall into a couple categories. Categories here referred to as subtypes. Now, some people talk about 4 or 5, some people even talk about 8. They're all different, but it's important that we consider all of them during our treatment. Now, the recovery time for PCS is not set. There's nothing specific. What we need to highlight is that prolonged rest may not be beneficial. Let me see that one more time. Prolonged rest may not be beneficial. There are treatment domains and additional treatment domains beyond each subtype. So these are active treatment opportunities and things that we can work on together. Some of the treatment domains that we focus on and that will also be present in the booklet that you have at home is education. This is kind of what we're talking about today. Nutrition, mental and psychological factors, vision, vestibular, that's our inner ear, the balance stuff, physical exercise, functional neurology, and cervicogenic, that's our neck muscles, ligaments, joints, all that stuff. All right, thanks so much for listening. There'll be more videos to check out